All right, in this video we are going through the 90-90 hip lift. The goal of this exercise is to really decompress the lower back for those people who hold a lot of lumbar tension or just spine tension in general. It's a good way to get the entry-level obliques and some deep core to engage. Your breath is very much involved on this, so we're going to take a breath in to start. Just let that air flood your system. You exhale. We're not doing anything yet. In a perfect world, this is a box breathing format, so it's a 4-second inhale through the nose. You hold at the top for roughly 4 seconds. Exhale through the mouth, 4 seconds. Hold at the bottom for 4 seconds. And you repeat that cycle. If this is a drill you're doing in the end of a work day and you're someone who has a high stress job, or you just feel like your system's just ramped up, maybe pain is high, maybe you're just feeling kind of tight everywhere, sit here and breathe for 3 to 4 rounds of this box breathing format in this position to just simply try to relax your system and try to melt into the floor. Once you've done 2 to 4 breath cycles and you feel like you've started to just allow your body to lay on the ground, before we move on, if you need a pillow, grab a pillow, keep your neck happy. As we go through this drill for real, we're gonna make sure our feet are just simply touching the wall fully. You're not driving into the wall, you just feel flush. As we go through this, the breath drives the entire thing. So we're gonna put one hand right where the diaphragm is, like right at the base of the rib cage in this little V of the rib cage. We're trying to be like right under or right on the xiphoid process, if you know where that is. Worst case scenario, just find belly button, go one hand width up, and then you're covering what feels like a little bit of the lower ribs and like the uppermost part of your belly. That's where hand 1 is. Hand 2 is kind of low belly, just maybe almost at the pubic bone, but not quite that low. From here, as we inhale, we're gonna breathe into the chest, hand number 1 and hand number 2 all at the same time. We want to feel a nice gentle swell of the entire front of the body as well as the backside, so a 360-degree expansion. The exhale is with an open mouth, and that exhale helps us tilt our pelvis up and slightly off the ground. And if we get that exhale and tilt coming from the right place, there should be a very subtle amount of core being involved to do this. Ideally, it's more the sides of the core, like obliques. We're not really going for dead set middle, like 6-pack abs. You inhale to just drop out of this. As you inhale, the whole belly and chest expand together. The exhale feeds the next hip lift and tuck. Next inhale swells the belly and the chest. And again we go. Inhale to relax out of it. You're gonna do 4 to 6 breaths at a time. We need to make sure that the breath powers the entire motion. Exhalation with an open, wide mouth helps get deeper abdominal stuff to work. So try your best to prioritize that. Probably best to potentially put a small ball or pillow between the knees if you're somebody whose knees want to open on their own and or collapse in on their own. We just want to put some type of prop between the legs that gives you something to slightly hang on to so you can maintain position. I don't have it here, but I definitely recommend it. This is something that you want to do probably 3 to 4 rounds of in this position back to back before you do anything else, especially if you're using this as a way to decompress your lower back, relieve tension in the body, and kind of restore resting neutral posture. And this is our 90-90 hip lift. I hope this is a helpful tutorial.